Welcome to Humans of Healthcare. I'm Ann Richardson. I'm here today, and for this episode, we're going to switch it up a little bit. I have recently, in the last year, become a colleague and now a trusted friend and partner of Danny Mobley. Danny is the founder of Humans of Healthcare, for those of you who've listened into episodes in the past. And so this morning, we were going to spend a little bit of time for those who are new to Humans of Healthcare to give you a little bit of a background in terms of the precipice behind the founding of Humans of Healthcare, what that means to Danny, what that means to me, and then how did Danny find me and why am I here today, and what is our plan going forward in terms of having conversations and bringing other humans of healthcare to this stage and to this conversation.
I'd love to give them some feedback on, or at least some history on how we got to where we are, to where you're sitting here. And humans of healthcare for me, I don't know, it's so random how it came to be. The way I think about the start and the idea, it's not as romantic as I would have ever imagined. You know, if I were to say, man, looking back, it was this, and this, and it was like I was driven by this, driven by that. I was actually watching a guy named Gary Vaynerchuk, who's a big time influencer. He actually sold wine way back, and he created this podcast to sell wine for his dad. He worked at his dad's liquor store, but he became really popular. He's got millions of followers. And so I was watching a podcast, which was new to me. And this was 2.5 years ago, around 3 years ago. And this podcast had Gary V, and it was like a 30-second spot, right? And he was talking to some random lady at a party, and it was really loud, but you could hear this lady come up to him and say, hey, I'm having this challenge with my daughter. She's totally engaged in social media, and she's this age, whatever age she was. She's like, I'm afraid that people might try to take advantage of her and bad things could happen with how she's interacting on social media. She's at that age where it's like she's, I don't know, capable of being influenced by outside entities, right? So vulnerable. And Gary's response to me was fantastic. I'd never seen this guy, but he was so confident. He said to this lady, this stranger he'd never met before, he's like, look, you know, as a parent, what you can do is make sure that your child, your daughter, is confident in herself and that she knows herself. And that's the best guard against anybody that she's going to run into in the social media world that she's in. And that struck me. So I started following him. And I now realize the brilliance of that clip that I saw and how they placed it, how Gary and his team placed those things out there to draw people like me in, you know? So there's a lot of like strategy behind that to get people. Yep. And that's the kind of people you really want, the ones that see clips like that stay watching you, and it gets to their heart, you know? And so you know your audience, if they come through that clip, it's a pretty good way to come in and get to know you. So I started watching him, and I couldn't take in material fast enough. Like his content to me was like, I couldn't wait to listen to it, watch it, whatever. I wanted to know everything about this guy. So I spent months just immersing myself in what he was about. And so he would do these keynotes, like big time keynotes, big stage, big events. And one time he was talking to a group of lawyers or like mortgage brokers or real estate agents. I don't remember. And he did this a few times, but this group was like completely into him. Yeah, like yelling and screaming because he had them fired up, right? And he's like, he said this, he stopped. He said, as excited as you guys are right now, and as cool as you think this is, the truth is, he's like, I know this, I've been doing this for a long time. 97% of you will walk out of this and not do anything different than what you've been doing. Mm-hmm. The 3% of you that might try, most of you are going to quit after you do it once or twice. And he said the biggest reason is because you're insecure. It's just human nature. People don't want their features. They might be embarrassed about their nose, their weight, their voice. You know, there's a lot of reasons. So I actually took that Pepsi challenge. You know, I was like, okay, I'm not going to be that 97%. I'm going to be somebody different. And so what I did, once I had that realization, just out of the blue, I went into a bedroom, a spare bedroom, and I got an angle from my phone. I turned my phone on, took a video, and I said to the world, hey, this is for my future generations of grandkids, or, for my daughter that ever might want to see me at this age in my life. It was like 40, early 40s, right? And so I said that on the camera, and then I posted it on LinkedIn, which is the only place that I knew to post it. And I got some affirmation. People were saying, great on you. I support you, would like to hear more, so on and so forth. It wasn't a lot, but it was enough for me to be like, okay, cool.
Inspires you to tell more.
Yeah, exactly. And then, so I got to see the impressions, how many people looked at it. So there's some basic data on LinkedIn that you can look at and see how many people saw your post, right? And it was more than anything I'd done before, because I just randomly, I dabbled in posts and forwarded and reposted and stuff in the past. So I did another video, and then I did another video, and it was just me. And then I got into it, and I had some success in my career, and I was kind of feeling myself, right? I was a little confident. And so I went out and did more and more of these things. And I thought, okay, what can I do to really help? And then I thought about the people who really helped me in my past. And they happen to be healthcare executives, specifically in rural hospitals and in Eastern Oklahoma, very specifically. And there were probably a handful of them that I remember so fondly. And I'm like, okay, after the past 25 years of my career, I wouldn't be where I'm at if it weren't for them. I was a 24-year-old nobody at the time who was an operator trying to be in sales for the first time. I didn't know what I was doing. And I would walk into these hospitals, and at least I had the audacity to ask for the CEO. And they would talk to me.
I love it.
It was amazing, right? Like, who am I? And that's the way I felt all the time. Who am I that they would talk to me? I felt so blessed and important. Humble, and all this. Very, very much so. And so that kind of kept going. They introduced me to other people. I won some business. But then over the years, I got to know these people so well, and it was more about them. It was more about the relationship and what they were teaching me, and how I felt when I was in their presence, right? I would go out to visit their hospitals. I would drive hours and hours and hours to get out to rural hospitals just to talk to them, and so they let me into their world. And so I'm going through this maturation, all these years later. And if they're the reason that I am where I am, it only made sense for me to pay forward to people like that. Right. And so it's that I latched onto. It's that idea that I latched onto. So now I have this opportunity to pay it forward. And I wanted to pay it forward specifically to healthcare executives. And so that's what I did. I started saying things on video that were things that I knew, stuff that I'd learned. I called it free consulting, right? Who am I to offer consulting is what I was thinking in the back of my mind. Like, I'm a nobody. That's what I think that a lot. I thought that a lot, especially. And so I started offering all this advice, and I would call the podcast back then Helping Healthcare Executives, which does not roll off the tongue, but it was like, that's what I called it, And so I started doing more and more and more. And then I started realizing that my edits and how long it was taking me to do all these different takes, and I didn't have any resources, just me, and I was only posting on one place. And I thought, well, if I really want to help, I probably should throw myself into what is social media. Well, there's this thing that, I now call organic social media, which is where you create free accounts and you put up your content on free platforms, Instagram, TikTok, all these different places. I didn't know that back then. I was just LinkedIn guy, And so I actually asked some people in my network if they knew of anybody who could help me, get these edited in the right way, get them posted in the right places, make sure I had the right captions and, all the stuff that's technical. I had no clue what I was doing. And it happened to run into somebody who was willing to moonlight. And her name's Annie. She's still with me today. So she's at a firm. She's a Gen Zer, full on, like 23 years old, but she knows this stuff inside and out, right? She's very talented. And so I pay her a little bit of money. She, does a couple of edits, posts these things for me. Then we start talking about strategy and things like that. We were watching podcasts to give me an idea, right, on how I can, get better and learn. But still, she liked my mission. She thought the mission was right. She could tell by the numbers of people who were watching and the demographics of people, the CEOs. Hospital CEOs were very early on the ones that I was trying to reach, and they were the ones that were showing the biggest percentage of who was watching my content, right? So we were on mark. We knew we were on mark. We were using the data that we had. But she said, hey, watch these. Watch Diary of a CEO. It's a great podcast to watch. She said, watch this thing called Humans of New York. And Okay, I watched that. And it's just like storytelling platforms, and, and it's just, and they're all different. And so time went by and we needed a better name. We knew we needed a better name, and we had been tossing around this humans of healthcare name. And so we just said, hey, I think that just makes the most sense given what we're trying to do, to tell stories. And you and I will talk about this humans of healthcare thing, but and the name and what it means and how, powerful that can really be. But we loved it at the time, and it was much better than helping healthcare executives. We didn't want to lose the idea that was the motivation, was to help healthcare executives, but it really was to help everybody, frankly, anybody who's associated with healthcare. And so since that time, it's just been, we've done interviews. That was a new thing that happened, after about 6 months of just me on the camera. I would do interviews and I would show just the person. I wouldn't be in the frame. So I was just having the camera focused on the people that I was interviewing. It was in person, some friends,
Yep.
One of them hit. Suki, he hit. He talked about some really powerful, passionate things that he'd experienced that were really dark. And it was in places you wouldn't think. The dark corners are in Ivy League schools, and, and up in very prestigious areas of the country, in New York at Cornell. Like, all these things that he would tell were in these places where you think, man, there's no way that's happening there. And Suki's an investor in one of my companies right now. He's super uber successful guy. But back then, in the late 70s and early 80s, he was an immigrant who was from Guyana, and he was getting abused and discriminated against. And there was a lot of things going on to him, and he got on camera, and he never told that story before. He told it, hundreds of thousands of people watched, and thousands of people commented, and it touched people who had experiences with racism in healthcare, whether they were patients, whether they were administrators, whether they were clinicians. It was rampant. And Suki's friends would call him, hey, Suki, I just saw this podcast that you were on, and I never known that about you. So Suki was getting like this great feedback. And that one viral experience was the thing that kind of gave me the ultimate confidence to continue down this path of finding those stories that would tell the story of the humans of healthcare. And so from there, it's just been, we've had some celebrities on. We've talked to people like Scott Becker. We've got some really cool people to spend time with us, that people I never thought would ever talk to me. We've had nurses. We've had people in a lot of circumstances where they would just say, hey, I'd like to come on and tell my story. And we're happy when people do that. So we've had the entire gamut, right? From one side, patients, to the other side, the biggest leaders and celebrities in healthcare that were on our podcast. And I couldn't be more thankful. I still have a little bit of imposter syndrome, if you will, around that stuff. Like, who am I?
Too.
Yeah, right. It's a real thing. And so now I'm in this position where I don't feel like there's anybody that I can't call that we wouldn't have an opportunity to talk to, and that they wouldn't be happy to tell their story on our platform. I'm really proud of the way we built it. I'm really proud of Annie. We've got great customers now. I've turned it into a business to where we're offering our services, so to speak, to other companies. We're offering sponsorships, and a way for people who have companies, who own companies, that don't otherwise have a way to tell the world about their company or advertise. This is really simple for them to latch on and put their logo on and do a little commercial with us or whatever. Not complicated. It's not about the money, but it's nice because, it costs thousands of dollars to do what we do, to edit and, fly people in and do all these things. And all I care about is just, not going broke. I will if I have to, but it's not what I want.
Right.
So this helps. That commerce parts help. But then along the way, you meet some really good people. And I've made friends with everybody that I've interviewed.
Yep.
Everybody. And I stay in contact with everybody. And I would imagine that if you talk to people that have done an interview on humans of healthcare, that they'll tell you they had a wonderful experience, and that, I think that me and Danny are friends. And I can't tell you how valuable that's been to the whole process. But then my network's expanded like crazy because of this, right? People in my family think it's out of character that I get on camera. I've not ever been that guy. I've been the shy, reserved person. So if I can do it, I promise anybody can. I still have the same insecurities that I've ever had, but I don't shy away from meeting people because of this opportunity. And I also now look for people who I want to do this with, right? It's turned into something where I don't want to do it alone anymore.
Right.
Right. And so for the past, I'd say 8 to 12 months, I've been on the lookout for a partner, for somebody that could come in and, number one, relieve some of the work that comes
Yep.
with this, but tell stories from a unique perspective that's different than mine, host from a different perspective, and somebody that has credibility within the healthcare industry, somebody that has credibility in general, somebody who's a good person. And you meet a lot, but it's hard to find those people who you think that of, the trust, the admiration,
Yeah.
The ability to sort of take something that's in its like infancy and make it something bigger and for the right reasons, you know?
Right.
So I've been searching, not actively, but I've been open to it. And so my network led me to you. And it was just one time that you and I met. And I think that's how open I was to it, is that your strength when you meet you for the first time, it's something that is noticeable compared to others that are in the room. And where I met you was a very safe place with a lot of really good people that I trust immensely, in an environment that is meant for us to come together and have, just for everybody who doesn't know, I have this, and I've told this before, I've got a Friday call that I join for rural
Yes.
healthcare leaders. And we start off with a prayer. We support each other during that
Yes.
call, and we end with a prayer. And it's the one time every week that I know that I can go and not feel isolated, and have friends that are there for the right reasons. And you don't worry about that. You showed up to that call, and there was just something about you that jumped out. And then we had another call right after that, and I saw you interact with another company you never met before. And I saw how you listened and how you threw yourself in and poured into what was right in front of you. So your passion just shows and it shines. And so that was my first exposure. And from there, I just wanted to try to get to know you better. So I followed up and tried to connect with you. I didn't want to be like, I'm one of those people, when I reach out, I want to be subtle, because I don't want to overwhelm people and be
Right.
the douchebag sales guy or whatever. So I avoid that, but I wanted to get in touch with you, and we did. And our relationships just sort of slowly and naturally, evolved. And you agreed to do something that I think was really big for you to do when you agreed to come to do our first podcast together. You hadn't done one in years. And you honored me, because you saw in me the way that I see myself, the way that I want to be to the world. And it reflected back to me what I was hoping you would see me as. And and then this week, when you come to town, we go to dinner, we have our conversation, which I cherish. And by the way, so then we get to do this stuff. And every time we talk, I feel like we're unlocking something else that we're going to do together, but it's for the good of the humans of healthcare. It's always, our conversations they're deep and they're intense to me, and I feel tired after, because I am I'm so into them.
Me too, because we do go very deep, and I have a lot of experience and a background that's broad, but I don't profess to know everything, and I don't have all the solutions. So I can share stories, but the same thing, I'm exhausted too sometimes, because I learn a lot.
Yeah.
And not only the stories of your background, but the people that you interact with and so forth. So
Yeah.
but yeah, so I view this conversation that takes place in these interactions on humans of healthcare. The relationship I have with you and you with others was born out of people that are mission driven and want to make a difference in healthcare. It doesn't mean that we're wealthy people who can go out and talk a lot and want to be heard and make noise. And, we don't need to be compensated for the work that we do. But this isn't about that.
Yeah.
This is part of that mission, because my dream has always been to be able to be compensated for the work that I do in a manner that always gives me time for me, for my personal life and things that bring me joy. And part of that is the mission piece and giving back. And so humans of healthcare, and why I was receptive, because you made an impression on me also when we first met with that group. Everyone on that call did, as we went around and introduced ourselves as like this it takes a special kind of person that on a Friday morning would agree to be part of that, right?
Sure.
Because nobody was selling anything.
Nope.
They were all talking about the challenges we have in healthcare today, but in rural America in particular.
Yeah.
And so we had former CEOs of rural hospitals and other executives and whatnot, and everybody had credible stories because they have firsthand experience.
Mm-hmm.
But so these conversations to me are bringing in people who, like me, I mean, I wasn't behind the scenes, but I didn't have the courage to go out and tell stories, even though I was courageous on the inside of hospitals and have spoken up more than a few times in my career and sometimes paid the price, like dearly.
Sure.
But there are people out there who maybe they suffer in silence or maybe they're quiet. They're not suffering. They're just in a behind the scenes role that's very critical to what we do in the delivery of patient care, but nobody knows who they are in their name because they're in one of those support roles in departments that no one, it's not so glamorous and nobody talks about, whether it's supply chain or it's facilities or it's IT. There's a lot of people out there who I know because of the way I managed and the areas that I managed that touched every surface in every department in a health system. You get to know those people, and I know how caring they are, how smart they are, how hard they work, and how passionate. But yet, because they're not the frontline nurse that might get more of attention in the media or a physician, no one shines the light on them. So I look at this as an exciting opportunity for people that I know in my professional network and people that they know, right?
Yep.
Who, if you open up an invitation at the end of this episode, we say, here's a link. Feel free to reach out to us. And maybe it's not like tell a story or your story, but just, tell, maybe it is a story, but it's a conversation that they want to have, but they haven't had the opportunity. And it gives them an opportunity to feel validated sometimes.
Oh, yeah.
And so you do need the courage to be able to go out in a public forum on camera and have that conversation. The best way I feel to do it and why it works with conversations with you is the relationship, the credibility, the trust, the respect, knowing that this is a person who has experience, who can understand, and a lot of, the challenges that you might share, that resonates with them. But there's also a level of curiosity, and not a curiosity to be, let's get a lot of likes and be that influencer, because that turns me off completely.
Yeah.
Almost to the point where I don't like the term, disruptor or influencer, because it takes on, depending on how people use it, various meanings, but it often has a negative connotation. Yeah. People wanting to, sell something, and maybe it's just selling their voice and their image, and that's okay, to each his own. But with humans of healthcare, even though you may have a conversation with people, I may have a conversation with people who have something to sell. Maybe they own a business. Maybe they're writers, clinical writers, or they're marketing a book. Whatever it is, this conversation isn't about that. They're selling themselves and their story and their credibility.
Yep.
And so if a viewer looks at it and says, wow, that doctor, wow, what a compelling story, they can go on social media, because we'll, share who they are. LinkedIn, for example, go and look at the profile. So if it happens to be that the person we're having a conversation with does have something to sell, maybe they're a wonderful coach, maybe they're a wonderful, consultant, whatever they are, well, you can do your due diligence, figure that out on your own. But the show isn't about selling.
Right.
It's about promoting and increasing awareness.
Yep.
Because somewhere along the line, see, we're all patients. And so even though we're talking about humans of healthcare, people outside of healthcare, with social media being what it is, no doubt are going to see a podcast episode where somebody's having a conversation about something that resonates with them.
Yeah.
And so that's what we're selling. We're selling and celebrating the humans of healthcare, the authentic humans of healthcare, and our goal is to increase awareness.
Yep.
And so with the vitriol that's going on in the country right now against healthcare, because we have a lot of negative talk, which is appropriate, about, highly compensated CEOs of systems. We have, headlines of, massive layoffs in hospitals, but yet the CEOs are still getting their contractual bonuses. We're seeing nurses threatening to strike and striking. We're seeing physicians now unionizing, primary care physicians, who would have thought, unionizing in some academic medical centers. So we're seeing a lot of negative headlines. And so it's important to bring as many voices as we can that have a story to tell as part of that.
Right.
It's not a defense of anything that's negative, but it's just to round out more of the stories, because, headlines are often, clickbait, and, they put things out there. You have to be on the inside of some of these topics or organizations to really, really understand the big picture.
Well, and it's interesting you say that, because the different vantage point that you and I have because of the way that we got into healthcare and our experiences, we're so different. I'm here this all started because I wanted to help healthcare executives, specifically based off of my interaction from the outside. I've never worked on the inside as a provider, never done that. You have that vantage point, and it manifests in really specific ways too already over the past few months, where I was thinking about, and I was sharing this with people because I wanted feedback, but I was thinking about doing a podcast specifically on burnout, and you told me something that I thought was really profound. And I realize how ignorant I am on a whole host of topics that, and these topics are talked about, and there's conversations going on with real people in the mix who are actually feeling burnout, right? And that's what I'm after. I want the people who are really going through that, and I want to know what they think, not what the clickbait is or the term burnout. And so that was a big one for me when you told me what you did about how people feel about that term, and what it could, essentially trigger within some faction of those that are actually having and experiencing burnout. And once you told me that, I'm like, I'm not doing that podcast. That's what I
mean, burnout is real for sure.
Sure.
It can lead to many other, conditions that are incredibly harmful. But it's just that there is among many in healthcare, particularly clinicians, who feel that it's overused and it's been monetized and used in an inappropriate way. Some will go so far as to say that some that have used it are clinicians who are preying upon their own, to get attention, whatever the case may be, and monetize whatever it is they're selling. And so it's real. I don't deny it. I just tend to kind of stay away from it, because the other thing is that if your podcast or your newsletter, your content, whatever it is that people are putting out, when you promote it and lead with burnout, you may actually not get the coverage that you had anticipated, because as soon as people see burnout as one of the hashtags or part of the promotion, they may walk away because they're burnt out on burnout. It's the best way to say
really well said. It causes, I call it the ick in some people's case. And those are the people that I care about. The people that would feel ick about that are important to me too, right? Because you can get burnout conversations going in a lot of places, but what we're more concerned about, like you said, I love the way you brought in the idea that there'll be people who own companies that, have a product, but, it's not meant to sell anybody. You're a great gatekeeper. You pride yourself on being a gatekeeper, and you believe that gatekeepers can really be instrumental in helping with what one of our major challenges is in healthcare, is having time to discern what's good, what's useful, what will make you more efficient, help you save money, whatever your strategy is, or your goals and objectives. But you can't evaluate everything, right? So if you can trust Ann or trust Danny to at least see that, hey, this solution is real, it's been vetted, and we would never put out anything in front of somebody, whether it's content or a potential solution or a product or a service, right? I think that could be really important to the people the humans of healthcare who watch this, to know that we're not just throwing something out there without having done research and our homework. That's a term you use quite a bit. Like if you just do some basic homework, you can find out a lot about some people, but nobody has time. Nobody has time to do homework. So if they trust us.
Yeah, and the other thing too about humans of healthcare is that it isn't about shining the light on people in leadership roles by title.
Yeah.
Because I feel strongly,
Yeah.
so many people I work with and have worked with over the course of my career didn't hold leadership titles, and maybe today they still don't.
Yeah.
Maybe they progressed. They're where they need to be and they're where they want to be. But in their own right, if you look at clinical folks, for example, or even the administrative folks that do patient access, and scheduling and do the greeting when the patient presents into a clinical and that type of thing.
Sure.
Or the unit coordinators on an inpatient unit and how they converse with family members and patients and so forth. They do not hold a leadership title, but in my mind, I always referred to them as a care team, and some of them challenged me. Well, I'm not. Why do you say that? And I said, because you are.
Yeah.
And you know what you do, and there's a tremendous. And then they'd smile and they'd say, "Thank you."
Yeah.
And so they were the part of the care team for sure, but they are the epitome of humans of healthcare because of the work that they do, and so they're leaders in their own right and in their own space. So let's say it's a, nurses still, when they talk to me, refer themselves to, I'm just a staff nurse. I said, first of all, nobody's just.
Yeah.
Because if you have a role in any organization where we provide healthcare, nursing facility, a freestanding imaging center, a hospital, whatever it is, or you could say this about any industry, but we're focusing on healthcare. You're not just. You're an important member of that workforce, that whether you're a direct patient care or you're in a back office, or front office, function where, you're not providing the care, you still have a role, however small you perceive it is, it's still part of the big picture, so it's never just. But if it's let's say a bedside staff nurse, and that's what they always say, oh, I'm a bedside staff nurse, like they all describe themselves kind of that way.
Sure.
And they are a leader for that patient that they take care of, right?
Oh, yeah, for sure.
Because when the patient has a great experience and is cared for by that nurse or a care team, you'll often see, in patient surveys, patients will remember nurses by name if they can, depending on how long they stay, and they'll remember, well, Lauren was fantastic on, 3 North, or, and they'll go so far.
Sure.
So who's to say that nurse that took care of that patient wasn't a leader?
Yeah.
And that's the epitome of being human.
Absolutely.
Because also, too, where we have staffing constraints in all areas where we deliver care, staffing constraints, right?
Yeah.
There are a few, areas where, people will say, oh, we're proudly, stable, our staffing is stable. Well, that's great. But in the instances where it's not, we expect the care teams, even if they're non-clinical part of the care team, to smile and greet the patient as if they're the only person that, that patient is the only person.
Yeah.
And so the professional human of healthcare, they're human.
Yeah.
And humans suffer, they feel pain, they're tired, they're all those things.
Oh, yeah.
Right?
Oh, yeah.
All those things. That's
All those
myself
things.
too, because trust me, it's really hard to have that high emotional intelligence quotient and be on all the time, be perfect, because you're human and you break down and you show your suffering and you show your exhaustion, you show your frustration.
Yeah.
And so those care team members every day, day in and day out, patient one after another in the emergency room, and they're coming in and out, they have to be the best that they can be for that patient.
Yep.
And I'm not saying that when they're not at their best, they're not a good human. They are.
Yeah.
But recognize the fact that healthcare is a challenge today.
Yeah.
A couple of years ago, I never trademarked it. I told people I was in the process of doing that, and I paused. But I always use the healthcare hashtag as health scare. And the scare was capitalized, so it's hashtag health and scare, because it really is scary.
I like that. Yeah.
And when we talk about healthcare, it's often a scary story.
Sure.
Right?
Sure. Oh, yeah. It's
and
scary.
So, but being the environment in some organizations can be very unsafe,
Yeah.
psychologically unsafe, we
Yep.
refer to it as, and toxic, and there's bullying.
Yep.
There's a fear factor. And so a lot of people suffer in silence. And all of us have worked with or for people along the way that you cannot help but sit back and say, oh my God, where's the humanity?
Yeah, for sure.
When people in executive roles have said to me, oh, you care too much. You know, you're not a nurse, you're not a doctor. Why do you care so much for your nurses and doctors? And I was in a leadership role, providing as much support, and sometimes it was empathy and human support, and saying, my God, you know, these surgeons that are high volume and whatnot, they're mothers too.
Yeah.
And they're, you know, they have and their daughters, and they're people.
Yeah.
They're people first.
Yep.
And if we don't take care of them and treat them in a humane, respectful way, then we have nothing for our people.
Well, there's a lot of opportunity, like we said too. Like, and I'll end with this: is that the humanistic side of healthcare is what we're after. We don't want to lose that with all of the AI and the technology that we see. There's a lot of folks out there that are worried about the humanistic side of healthcare being lost, and that's the name of our podcast. It's not on accident. We want to keep the humanistic aspect of healthcare in healthcare, and the only way to really let people know that that's happening is through storytelling. That's our opinion anyway. That's the way we feel strongly about it.
It's relationships,
Yes,
and
that's it.
healthcare is very transactional, and we want to make sure that we always keep the human, the real human in healthcare, and be able to reinforce the importance of the relationship.
Hey, this is your host, Danny Mobley. Thanks for watching Humans of Healthcare. Please subscribe below for more great interviews.